The Glasgow Coma Scale is typically used on the scene and performed by the ENT and or the ER physician, and it's a way to measure severity of brain injury acutely. There are 3 sections. There's an eye-opening section, a motor section, and a verbal response section. The motor section provides the greatest amount of points towards your final score, and in this case a high score is a better score and a low score is a worse score, or it's the most severe type of brain injury, and the scores range from 3 to 15. So you never have a score of 0, 1, or 2. The lowest score is 3. Let's go through the motor section first, since this is the largest section. The first thing you want to do is ask your patient if they can follow your verbal command to move their arm and legs. If they cannot voluntarily move their arms and legs when you ask them to, you're going to perform a painful stimulus, and that is deep pressure to the nail bed of the finger and toe. And you're looking for one of 2 responses. Either they have a reflexive withdrawal, like the flexion withdraw reflex, or they have a purposeful withdrawal. A flexion withdrawal is worse, so to speak, than a purposeful withdrawal, because one is at the reflex and one it has more awareness, whereby the person is trying to push the painful stimulus away as they're withdrawing from the pain. Okay, and then you also observe your patient and see whether they have decelerate posturing, which is severe spasticity where all of the limbs, arms, trunk, and extremity are in extension, or decorticate posturing, where the upper extremities are flexed and the trunk and lower extremities are extended. Worst case scenario is no response at all. So no posturing, no response to voluntary movement. So if we run through the scores, a 6 would be the patient follows commands to move the arms and legs, so has voluntary movement in response to a verbal command. That would be 6 points. If there is a purposeful withdrawal to the painful stimulus, that would be 5 points. A withdrawal reflex would be 4 points. Decorticate posturing would be 3, decelerate 2, and no response would be 1. And with the decelerate and decorticate posturing, that usually means that there's been some kind of a herniation and the brainstem is being compressed, causing that abnormal posturing, or severe what we call spasticity, where the limbs are held in a rigid, flexed, or extended position. If we move up to eye opening, follows the same kind of pattern as the motor, but you don't have as many choices. So A1 is no response. The eyes are closed. No matter what you do, you apply a painful stimulus, they don't open them. You call their name and shake them gently, and they don't open their eyes, so there's no response whatsoever. A 2 would be they open their eyes to the painful stimulus, so applying the nail bed. And a 3 would be that they open their eyes to speech. So you say, Billy, Billy, open your eyes for me. And they open their eyes, so they don't need a painful stimulus. They don't open their eyes spontaneously, but they do open them to speech. That would be a 3. And then spontaneous eye opening would be just patient, you walk into the room, they already have their eyes open, or they hear you walk into the room and they open their eyes. And just spontaneous, that is 4 points and the highest score you can get for eye opening. Verbal response, no response, so the patient is not speaking, they don't speak to you upon request, and they're making no sounds, no groans or grunts. That would be a 1, no response. A 2 is they're not creating words, but they're grunting and moaning, so they're something like that, but there's no words at all, just making noises. That would be a 2. And 1 up from that is a person who is incoherent. So maybe if you can think of like someone who's really intoxicated, where you know they're trying to speak, but their words are very slurred and you can't understand them, and they're not making sense at all. So they're disoriented and incoherent. Whereas a 4, the person is just confused. So you may ask them how old they are and they tell you the wrong age, or they don't know where they are, they don't know what's happened to them, so they're disoriented. But when you talk to them, they give you a coherent answer. It's just an inappropriate answer whereby they're disoriented. Okay, and then a score of 5 means they are completely oriented to person, place, and time. So it does follow a logical sequence.